Good afternoon, friends. I am Dr. Mayur Kasat, consultant orthopedic and joint replacement surgeon practicing in Pune for last 8 years. And you are at my clinic in Pune where I am since last 5 years practicing. Now, today we are going to talk on total knee replacement surgery. What should be the preparation for the patient before the surgery, after the surgery, during the hospitalization, everything you want to know about total knee replacement surgery in about 3 to 4 minutes. Now, coming to the total knee replacement surgery. This is done in usually cases like osteoarthritis of the knee and rheumatoid arthritis of the knee joint. What is osteoarthritis? Osteoarthritis is a degenerative disease involving the knee joint where the cartilage over the bone of the knee joint get damaged, and because of that damage bone is exposed and bone to bone friction causes reduction in the joint space, which gives condition like osteoarthritis. There are different stages and the treatment is different varying from each stage. Like in cases with stage 1 and stage 2 of osteoarthritis, I usually give physiotherapy, ice application, some sort of knee strengthening and quadriceps exercises, and if required intraarticular hyaluronic acid injections, which help in giving the good lubrication of the joint inside the joint and helps in prevention of further damage, as well as in some cases helps in getting new cartilage regeneration. Coming to the next part, like stage 3 and stage 4 arthritis of the knee joint, where there are different treatments other than the medication or physiotherapy, such as partial or total knee replacement surgery. Coming to the partial knee replacement or unicondylar knee arthroplasty surgery. This is done in cases where there is only one compartment. 95% of the cases, medial compartment, that means inner compartment of the knee joint is involved. Whereas in that case, I usually do partial or unicondylar knee replacement surgery. That means changing only one compartment of the knee joint like this, where I'm just changing the damaged compartment, one compartment at the lower end of femur and upper end of the tibia in the medial compartment of the knee joint, giving mobility to the patient. In these cases, I usually admit patient just for 3 days. Patient is getting operated on the day of surgery after pre-operative investigation and physician and anesthetic fitness. After the surgery, immediately next day patient is mobilized with the help of walker, and patient starts with physiotherapy and rehabilitation program for walking, knee bending exercises, static quadriceps exercises with some sort of ice fomentation and some anti-inflammatory medicine. Patient walks out of the hospital on day 2 of after the surgery comfortably, and I take out the stitches after 2 weeks. Coming to the other form of surgery, that means total knee replacement surgery, where there is tricompartmental osteoarthritis of the knee, where there are both the compartments like outer compartment of the knee joint, inner compartment of the knee joint, as well as patellofemoral compartment of the knee joint is involved. In these cases, preparation of the patient before the surgery is quite important, which is quite often neglected. Patient needs to be started with, I personally start on this patient with paracetamol 15 days or 10 days prior to the surgery to get rid of pain. And again, along with that, I start them with ice application 4 to 5 times a day, walking with the help of support if patient needs. Along with that, some physiotherapy to strengthen the knee muscles. After preoperative investigations and physician and anesthetic fitness, once patient is admitted in the hospital, then comes the day of the surgery. There are two worldwide accepted methods for total knee arthroplasty surgery. Like one is there are two approaches for the surgery. One is routine median parapatellar approach, where we are cutting the quadriceps muscles, going inside the knee joint, doing the surgery and putting back, suturing the quadriceps function and doing the surgery. But what I do regularly is subvastus knee replacement surgery, where I am not cutting the quadriceps or vastus muscles which is covering the knee joint and which is helping the patient or everybody for knee functioning like knee bending and knee strengthening. What I am doing is I am just going beneath the quadriceps muscle, reflecting it and doing the surgery, and then putting the quadriceps muscle back in position, avoiding sutures, blood loss to the quadriceps and giving good strength during the surgery itself for the quadriceps muscles. Now coming to the total knee replacement surgery. When both the compartments, that means outer and inner compartment of the knee joint, both the compartments are involved with the arthritis, I do total knee replacement surgery. That means changing both the compartments of the knee joint. For this, I am using a different approach for the surgery, like I call it as subvastus approach, where I am not cutting the vastus muscle which is giving strength to the knee joint in the functioning of the knee joint. I am just going beneath the muscle, retracting the patella and then down to the knee joint and doing the surgery. Once I am done with the surgery, I put back the quadriceps or the vastus muscle in position. That means there are no stitches over the muscle. That means there is less blood loss and early mobilization. It helps in early mobility of the knee joint and strengthening is appropriate. Coming to the post-operative protocol. On the day of the surgery, post-surgery, I immediately start with in-bed mobilization, like in-bed exercises, static quadriceps exercises, and some sort of knee bending exercises. For pain management, I personally prefer post-surgical femoral nerve block. That means blocking the femoral nerve at the upper portion of the thigh, which gives painless feeling post surgery to the patient, and it helps in taking the stress out of the patient which they have during the surgery, that how it will be after the surgery, how much severe pain will be, that is the question for every patient. So two things which I would like to mention here: one, femoral nerve block is helping patient getting rid of the pain, and another is, as I mentioned, subvastus approach. In this, vastus muscle is not cut, so there is less pain, less blood loss. On the next day of the surgery, I start mobilizing the patient like standing full weight bearing, walking with the help of walker with some help, and getting relief from the pain with the help of some painkiller NSAIDs tablet. Patient is walking within 12 to 24 hours post surgery, and I personally discharge the patient 3 to 4 day post surgery in case of single knee replacement or simultaneous bilateral total knee replacement surgery. Once patient is at home, patient has just to do physiotherapy exercises, ice application, and take some NSAID tablets. I prefer to ask the patient to walk with the help of walker for initial 3 to 4 weeks, followed by a tripod stick for next 1 to 2 weeks, and then patient can walk independently without any support. This is how it is. So guys, don't feel bad to ask me anything about the total knee or total hip replacement surgery. You can connect me through Lybrate, or else you can directly connect me on my email as well as my number, which is mentioned there on lybrate.com. Thank you very much for the listening whole topic. Good day.